Hi, you're watching this video because you or someone you love suffers with thyroid issues. Hi, my name is Dr. Keith Lynch. I've been practicing in Charlottesville, Virginia since 1998. And what we're going to discuss right now is our unique program on how we help people who suffer with thyroid symptoms. Now, when we're saying thyroid symptoms, perhaps you've already been diagnosed with a thyroid condition, or perhaps you just think you might have a thyroid condition. Maybe your hair's been falling out, you don't have energy, you're not sleeping well, you're not waking up well rested. There's weight gain issues often with thyroid sufferers. We often see cold hands and feet, dry skin. These are some of the issues that tell us that your thyroid is not functioning properly. In our office, we have a unique program where we look at you both metabolically and neurologically to help you improve your life. When I say metabolically, I'm particularly referring to certain blood tests that we run. Now let me explain that to you. When we do blood work, we look for a complete blood count with auto differential. We want to know what's going on. We're also going to do a complete metabolic panel. We're going to do a lipids panel. We're going to check your vitamin D levels. We also want to see a thyroid panel. Now I know you're thinking, I've already had blood work run. I was told everything was normal. I'm sure it's not. This is why. In our office, we look at functional optimal ranges of blood work. Not the range that you get from Quest or LabCorp that's a really wide range. Basically, you've been told already, they look at your range and they say, everything looks normal. It's a little low, but it's low normal. It's not low normal. According to the ACCS, or American Clinical Chemist Society, or the Endocrine Society, we use their functional optimal ranges. So let's take TSH, or thyroid stimulating hormone, which is produced by the pituitary and calls out to the thyroid and says, hey, produce thyroid hormone. That level, according to LabCorp and Quest Diagnostics, can be anywhere from 0.5 to 5.0. That's a huge wide range. You could drive a truck through that. According to the ACCS and the Endocrine Society, that number should be 1.8 to 3.0. That's when it's functioning optimally. If it's outside of that range, there's something else going on. Your thyroid produces 7% of the useful amount of T3 hormone. The rest of it is converted in other places in your body, which is why you need a complete metabolic panel. We need to look at all of you to find out what's wrong with your thyroid. We're going to look at your brain function. So in that blood work, we need to see if there are any fuel delivery issues. Do you have any anemias, any blood sugar dysregulation? Either one of those is going to decrease your capacity neurologically to run your brain well and your body well. That's why it's so important. We're going to be looking for liver dysfunction. A lot of conversion of T4 into T3 happens at the liver. It also happens in the intestines. We need to know what's happening there and if they're working properly. Also, your intestines have most of your immune system inside of them. If that's not working well, how are you ever going to get well? These things have to be looked at. You could have a problem with fatty acid metabolism, or you can have an autoimmune condition like Hashimoto's, where your body's actually attacking the thyroid tissue in your body and destroying it. How do you help somebody with these conditions if you don't know those answers? Now, in the endocrine system, we have the pituitary, the thyroid, the adrenals, and the male and female sex organs. When we look at all of that together with someone who's suffering with thyroid symptoms, we need to know what's going on with all of them. So we're going to look at what we call an adrenal stress index. We want to see the output of the thyroid, but we also want to see the output of your adrenal glands. because your adrenal glands are going to produce cortisol. More of it in the morning, less of it as the day goes on, because cortisol has an inverse relationship to melatonin. So you should have a lot of energy when you first wake up in the morning. That should gradually decrease during the course of the day. At the end of the day, you should be able to hop easily into bed, fall asleep, stay asleep, and wake up well rested. If you're suffering with thyroid dysfunction, you don't have that. Has anybody even done this test with you? The answer is probably no. Insurance companies don't pay for these type of tests. Medical doctors typically don't run these tests. They don't look at them, and they don't use them when they formulate treatment protocols. They look at your TSH levels, and they regulate you with levothyroxine, Synthroid, Armour. These are hormone drugs that are designed to make your body think you have more hormone than really is there. And they don't correct the other issues. When we look at you, we're looking at your intestinal function. We're looking at your hormone levels. We're looking to see if your immune system is overactivated. When we have all that information, we have what's called your owner's manual. When you have your owner's manual, now you know what you need to do to get yourself well and to stay well. Nobody else can get you your owner's manual. Your medical doctor's not going to get it for you. Your insurance company's not going to get it for you. It's going to be your responsibility to get these tests run so that you know what's happening in your body, how to get well, and how to stay well. Because you've already been to probably a dozen or half a dozen specialists, and they all speak a different language, and they all look at different things. And when they're done, are they talking to each other about it? Are they on the same page with you on what needs to be done? Are you happy with the outcome? If you bring me your blood work, bring me any diagnostic studies, MRIs, CT scans, blood work, I speak that language. I'll be able to help you with that. I will do a thorough neurological examination to find out functionally which areas of the brain are working and which areas are not. With proper fuel delivery and proper activation, we can improve brain function. If we can improve brain function, we can improve how your body works, how you feel, and we can help you improve your life. You need to think about how long you've had this condition. How is it affecting your life, your job, your relationships? How much time, money, and energy has it cost you? If you don't get this corrected, where do you see yourself in 3 years or in 5 years? What would it be worth to you to get this condition to be improved? My name's Dr. Keith Lynch, and I look forward to helping you get your life back.